Today's topic is vaginal cancer. Vaginal cancer is a type of cancer arising from the vagina. The vagina is a hollow channel that connects the opening of the uterus with the outer genitals. At birth, a baby passes out of the body through the vagina, also known as the birth canal. Vaginal cancer occurs more often in women over the age of 50, but can occur at any age, even infancy. If detected early, it can often be cured. Vaginal cancer that spreads beyond the vagina is much more difficult to treat. While several types of cancer can spread to the vagina from other places in the body, cancer that begins in the vagina is very rare. It is called primary if it starts off in the vagina, and secondary if cancer spreads from other body parts. There are two primary types of vaginal cancer. Vaginal squamous cell carcinoma arises from the thin, flat cell or squamous cell that line the surface of the vagina. It is the most common type of vaginal cell and is found most often in women aged 60 or older. Squamous cell vaginal cancer spreads slowly and usually stays near the vagina, but may spread to the bone, lungs, or liver. Vaginal adenocarcinoma arises from the glandular cells. Glandular cells in the lining of the vagina make and release fluids such as mucus. Adenocarcinoma is more likely in the lungs and the lymph nodes. Causes. It is not clear what causes vaginal cancer, but certain risk factor has been associated with the condition. This may include age, prenatal exposure to dethylstilbestrol, infection with HPV type 16, a previous history of cervical cancer, smoking, HIV infection, chronic vulvar itching, previous hysterectomy, being diagnosed with vaginal intraepithelial neoplasia. Symptoms: pelvic pain, especially during sex, constipation, painful urination, lump or mass in the vagina, watery vaginal discharge, abnormal vaginal bleeding not related to menstrual periods, for example, bleeding after intercourse. Diagnosis and treatment. The doctor will first take your medical history to find out more about your symptoms and possible risk factors. Then the doctor will carry out a pelvic exam, during which the outer genitals are inspected. During the pelvic exam, the doctor will also use a speculum to widen the vaginal canal and check for abnormalities in your vagina and cervix. The doctor will do a pap smear to check for abnormal cells in the vaginal area. If any abnormalities are detected, the doctor will carry out a colposcopy. In this procedure, a magnifying instrument called a colposcope is used to examine the vaginal walls and cervix to see where the abnormal cells are. During the colposcopy examination, the doctor may remove a small tissue and send the sample for testing in a lab. The stages of the cancer are determined based on how far cancer has spread. This will help the doctor to determine the best treatment option. Imaging tests such as X-rays, CT scan, and MRI can be used to determine your cancer stage. Stage 1. Cancer is confined to the vaginal wall. Stage 2. Cancer has spread to the tissue next to the vaginal wall. Stage 3. Cancer has spread further into the pelvis. Stage 4A. Cancer has spread to nearby areas such as the bladder or rectum. Stage 4B. Cancer has spread to areas away from the vagina, such as the liver. Treatment. The stages, type, your general health, and preference will determine the treatment option. Treatment option may include surgery to remove small lesions or tumors, surgery to remove either part or all of the vagina, as in vaginectomy, or to remove your reproductive or pelvic organ. Radiation therapy that uses powerful energy beams such as X-rays to kill the cancer cell. Chemotherapy that involves using medication injected intravenously or taken orally to kill the cancer cell. Supportive care that aims to improve the quality of life for people with cancer and their families is helpful. If combined with all of the other treatments, people with cancer may live longer and feel better. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel.
Jennifer is 56 years old. She's been noticing for weeks that after sex she has a vaginal bleeding. She's worried. Lately, this sex is becoming increasingly annoying. Can this vaginal bleeding hide a vaginal cancer? Phoebe is 67 years old. She no longer has menstrual periods long time ago, neither she is sexually active anymore. A few weeks ago, she has started noticing a vaginal discharge and she has frequent urinary tract infections. She is worried and will go to the doctor to consult. Will this discharge and this cystitis have some relation with vaginal cancer? Watch the full video. You'll learn to distinguish all the symptoms of vaginal cancer so that in case of suffering it, you might suspect it as soon as possible. Let's talk about symptoms of vaginal cancer. This tumor is usually located more frequently in the upper third of the vagina, on its rear wall, being difficult to palpate by the woman herself. If cancer is limited to the vagina, it may appear in different ways. Let's see them one by one. Situation 1. Gynecologist detects vaginal cancer when it hasn't caused any symptoms yet. In women who go to periodic reviews, in the physical exam carried out by the gynecologist, a lesion in the vagina can be detected. On vaginal palpation, a lump can be noticed on its wall, or in the vaginal inspection, some wounds or ulcers can be seen. One important number and one important clarification. The number. 1 in 5 cancers of the vagina are diagnosed this way, without any symptoms, so be sure to follow gynecological examinations. The clarification. Not all lump or wound or vaginal ulcer will be a vaginal cancer, so a woman must not go crazy as soon as she feels something inside her vagina. Situation 2. Vaginal bleeding in a woman after having sex. A common symptom of vaginal cancer that has not spread outside of the vagina is the appearance of bleeding in a woman after sex. Not all coitorrhagia, which is the name of this type of bleeding, will be caused by a vaginal cancer. In cervical or uterine cancers, they could also appear. Vaginal bleedings that may be motivated by a vaginal cancer are those that get worse and that increasingly appear in nearly every sexual contact. Situation 3. Woman begins to suffer pain with sexual intercourse. If vaginal cancer grows, it is very common that penile trauma during intercourse can cause discomfort in women. At first, it will be a feeling of nuisance, which will turn into real pain, a symptom called dyspareunia, which progressively prevents women from having sex. Situation 4. Vaginal discharges with malodorous material appear. If vaginal cancer grows a lot and a woman doesn't notice it or doesn't want to consult, frequently a vaginal ulcer becomes infected with microorganisms of the vaginal flora. An infection will develop that will generate a mixture of serous fluid secretion, pus, blood, and dead cells emanating from the vagina continuously. Situation 5. Woman with vaginal cancer repeatedly suffers urinary tract infections. Because women have a shorter urethra, microorganisms of the vaginal flora and this secretion due to vaginal cancer can climb the urethra, originating urinary infections that will make the woman suffer from symptoms of cystitis very often. That's why women suffering from cystitis and urinary tract infections has to go to the gynecologist and get a detailed examination. Situation 6. The tumor grows forward and compresses the urethra. If the tumor grows hugely, it can push into the urethra, which is the tube that carries urine from the bladder to the outside. If cancer simply pushes the urethral wall, it can cause difficulty urinating. The woman will have to push harder to empty her bladder. Cancer can even completely close the outlet of urine. If this happens, woman will have abdominal pain due to the bladder swelling, although this happens seldom. If cancer breaks the wall of the urethra, blood could appear in the urine, causing symptoms of cystitis and staining urine red, a phenomenon called hematuria, but this only occurs in very advanced tumors. Situation 7. The cancer grows backwards and compresses the large intestine. If vaginal cancer prefers to grow backwards, being its neighbor the final section of the large intestine, the rectum, that is the place where feces accumulate before being expelled through the anus, when vaginal cancer pushes this hollow tube, makes the stool transit more difficult, which favors the constipation. We have seen the symptoms that vaginal cancer can cause, but what happens when the tumor escapes from the vagina, either through the lymphatic system or through blood? Let's see it. When the tumor is already out of the vagina, it may be because it has followed two different paths. The tumor escapes through the lymphatics, or tumor cells enter the blood. Let's see where each of these two ways can lead. Situation 1. Tumor has escaped through the lymph vessels. Vaginal cancer cells, if cancer is located in the upper portion of the vagina, can get into the pelvic lymphatic chains. When these nodes fill with tumor cells, they often cause no symptoms. If the tumor is located at the bottom of the vagina, its first escape route is the growing lymph nodes, which will increase in size, growing a lump that can be felt directly by hand. Rarely, when there is a large involvement of pelvic and inguinal lymph nodes, the rise of lymphatic fluid can be interrupted, making these liquids remain in the leg, which will increase in thickness. This is called lymphedema. Situation 2. Tumor has escaped through the blood. When cancer breaks a blood vessel near the tumor and accesses blood, cancer cells travel throughout the body. In places where, due to their special conditions, they like to stay and live, these cells leave the blood vessel and settle, growing and multiplying. In the case of vaginal cancer, the most common sites where metastases appear are in the lungs, in the liver, and in the bones. Lung metastases. When tumor cells get to the lungs, usually grow separate groups, eventually appearing multiple metastases, which increasingly get bigger. If these metastases cancel enough lung function, they can cause difficulty breathing, a symptom called dyspnea. If they touch a breathing tube, bronchus, or their branches, they will irritate them, causing a very annoying dry cough, very difficult to alleviate. If metastases are placed near a pulmonary blood vessel, they may break it, pouring a little blood with cough. Liver metastasis. When vaginal cancer cells are established in the liver, they begin to grow widely and begin to crush liver cells. When broken, contents of these liver cells, which are transaminases, get in the blood, thus increasing their levels, as detected in a blood test. If metastases compress small channels that carry bile within the liver, it may increase the amount of bilirubin in the blood, and skin gets a yellow tint, phenomenon called jaundice. Bone metastasis. When tumor cells grow inside bone, if metastasis becomes very large, it can break the overlying layer that has great sensitivity, the periosteum. When this happens, pain appears. This growth compromises bone strength, and especially if bone has to bear weight, it may break. A special case of bone metastasis occurs when vertebrae are affected. Back pain may appear, and if vertebrae breaks, it can cause neurological symptoms that fall into spinal cord compression syndrome, which is an oncologic emergency. As you can see, vaginal cancer may cause the appearance of many signs and symptoms. Let's summarize them. Symptoms that vaginal cancer can cause are: in the vagina itself. Most often, vaginal cancer is diagnosed in an exploration made in the gynecologist's office. It is also common the presence of vaginal bleeding after sexual intercourse. Less frequently, vaginal cancer can present as a progressive discomfort when the woman has sex, progressing to frank pain, vaginal discharge of malodorous material, cystitis and recurrent urinary tract infections, hematuria and even obstruction to urine flow when urethra is pushed, progressive chronic constipation if the tumor grows backwards. In regions of lymphatic drainage, most often vaginal cancer does not produce any symptoms. Seldom a lymphedema can appear. In the rest of the body, if vaginal cancer spreads through the blood, most often it can cause cough, hemoptysis or dyspnea if metastases locate in the lungs, increased transaminases or jaundice if the liver is affected, or bone pain or fractures if metastases grow in bones. It is very important to know which symptoms vaginal cancer can cause. Do not forget to carry out the actions of early diagnosis of this tumor as prescribed by your doctor. Early detection of vaginal cancer is the best way to beat him.